protocols and statistics at SCDC. Hear from a constituent who requested to testify and discuss potential findings and recommendations for the subcommittee study of the SCDC. If necessary, we'll take a lunch break from 1 to 2. Director Sterling, please come to the podium to provide an update on COVID-19 protocols and statistics at SCDC. As he comes to the podium, I want to remind members the related information we received from SCDC and posted online last week is included in your notebook for easy reference. Director Sterling, please make sure the microphone is on, then state your full name and title and begin whenever you're ready. As a reminder, you are still under oath.
Yes, sir. I'm going to take my mask off when I talk, if that's okay.
You know.
I would like to ask Melanie Davis, and I'm going to have Dr. Clark introduce herself to come up, and then I'm going to have Dane right here. So if y'all would come up and introduce what you do, because they're the technical experts on what we're doing at SCDC on COVID.
I would say and recommend that if you go over to them to ask them questions or talk to them, that you mask and
Yes.
and you all be masked. Okay.
So while they're coming up, yes, come up here. We currently have 129 positive, we've had since the start, 129 positive COVID, 79 have recovered, and 93 staff, 2 offenders have passed, and we've had 1 staff member pass. We're not sure. We don't think he got it at where he was working. He worked also at a restaurant, so we could remember him and his family during this time. 67 staff have recovered. I'm going to start with our new Director of Health, Dr. Clark. I think you can take your mask off if you like. While y'all talk, because you're 6 feet away. So, Doc, if you want to just give a brief background of yourself. I think it's on. Test?
Testing?
Yep.
Okay.
Good.
Hi, my name is April Singleton Clark. I am a family medicine practitioner. I did my undergrad training at Hampton University and went on and did my medical school training at Creighton University School of Medicine. I've worked in various capacities before I joined here in September of last year. I originally signed on as the Chief Medical Officer, but now serve as the Interim Deputy of Health Services or Medical Services at this time.
Is it working now? Yes. I'm Melanie Davis. I am the Director of Infectious Disease Management. I have a laboratory background. I've been working for the agency for 21 years, previously as the lab director for SCDC, and in the last 4 years in infection prevention.
One of the first things I'd like to point out in the presentation, which I think y'all have, but this is updated, I think, as of today. We've done a sheet of staff cleared, inmates cleared, and that's on our website. We've got COVID protocols on our website, so everybody can see what is going on. Yeah, it changes daily, so that's not in the presentation. But anyways, so percent nationwide, you can look and see of the percent across the country. We track this also. Before I start my presentation, I really would like to highlight what my staff has been doing at SCDC. Melanie, Dr. Clark, healthcare, Dane, Joel, Nina and her folks, Tom and his folks, Dr. Kunkel. This is an unprecedented time to be a director of any agency. This is an unprecedented time to be alive with what we're seeing. We never thought we'd see this. You know, we all thought it'd be Dustin Hoffman running around looking for a cure. You know, the movie Outbreak, but this is real, and this is happening. And this is happening not only outside, but this is happening inside our facilities. We were, I think, the second or third state to shut down visitation, to shut down corrections, to shut down folks coming into our facilities. We've had to learn as we go. We'll have to be careful because there is ongoing litigation right now. The ACLU and P&A have sued us in federal court. So I may or may not be able to answer questions that could be leading down a path that could be part of that lawsuit. So I'm very proud of the way SCDC has responded to this. These folks sitting up here literally have been working around the clock. They'd be working right now at SCDC to make sure that not only are the staff safe, but the folks that are incarcerated are safe also, and the public is safe. We started off with phone calls with the Hospital Association. We started off with phone calls with DHEC. We're in constant conversation with DHEC about what to do. But, I mean, there are some nights where they're up there till midnight, at least, and they're getting there at 7 o'clock in the morning. We check on our staff that are sick every day. They get a phone call, a text, however they want it. And we are doing everything we can to make sure that not only do our staff stay safe, but the folks who are incarcerated stay safe. We came up with a plan where to quarantine folks. We came up with an app. Our folks came up with an app. Dane and her team came up with an application where you take your ID, and I'm sure that's in here, and it's swiped at the front, and it's green for go, that means you're good, and it's red for not, that means you cannot come into the facility because you're not cleared by our folks that are sitting here. But I am really proud of the way our folks have responded to this, the way they've stepped up. I can't say enough about what they've done, and I'll never be able to say enough, and I'll never be able to thank them enough for what they've done during this unprecedented time. We've had people showing up to work. That was a concern. If you think about it, correctional facilities, it can spread very fast, but we're not getting a lot of people calling out. Our medical staff is showing up. Our officers are showing up. These folks literally are working around the clock to make sure that everybody is safe. Education materials go into the presentation. I think it might be page 3. Education materials is posted in the offender living area on kiosks and tablets where available. PPE, we were one of the first states to give masks. Every offender has 2 masks. We tried to work with Reform Alliance, Jay-Z's group. I reached out when I heard what was happening in Tennessee, and the offenders are given masks. All our staff has to wear masks unless they, of course, have a pre-existing condition, which folks with masks on will understand why we would not require that. We produce masks for all offenders, correctional staff to wear. Each employer prisoner received 2 masks each, which can be laundered and worn again. Facility staff are also permitted to bring their own PPE, such as masks. Staff are expected to wear their mask during the entire shift. Offenders are expected to wear their mask at all times. Extra PPE has been secured for outside vendors who are critical to the institution's daily operations. Anyone entering a facility are screened prior to admission, so we have a rigorous screening process. Have you been around anybody? Have you traveled? We have a list that Melanie and Dr. Clark make where if you've gone to a certain area that's a hot spot and it's changing, as we see with the news, you cannot come into the facilities. Temperatures are taken. Anyone suspected of having COVID will not be allowed in the facility. Staff are sent home if they start developing symptoms while at work. They're encouraged to get tested if symptoms are consistent. One thing I'd like to point out is MUSC's partnership with us during this. We've reached out and they've stepped up. We were having an issue at first, as everybody was. It was taking 72 hours or so, or longer, I think, to get test results back. And that was a problem because, you know, we have limited staffing as it is. We have limited medical staffing. We have limited correctional staffing. So if it takes a couple days before you're cleared, or 2 weeks, that's a big deal. So what we did was we partnered with MUSC. We weren't having any problems in the upstate. We're having some problems here. Obviously, in the low country, they could go to MUSC. But we get the results back in
24 to 48.
24 to 48 hours. That way they know they're clear. They can go to a place, they say, we're first responders. A lot of people forget. Corrections officers are first responders. That's been tremendously helpful. We pay a little bit for the test to be transported, but that's been very helpful. Contact tracing. And if y'all have any specific questions on what we're doing, please ask, and if I can't answer, I'll have my folks answer. SCDC performs contact tracing when a positive test is reported by an employee. Contact tracing investigation is completed to determine what other employees or offenders the COVID positive employee may have encountered close contact.
Mr. Director Sterling, how many tests have been given? Are you gonna do that later?
So, number of inmates tested 550. The employees number who, let me see here. Do we know how many employees? Because that's self. The employee can
It's
get their own
self-
test, so we don't track the employees. Number of inmates tested is 550. Yes, sir.
Mr. Jefferson?
Have you noticed various symptoms, or are all of the symptoms identical?
No.
Go ahead, Dr. Love.
Sorry.
No, you're the expert.
We have noticed, actually, very soon after the CDC published their criteria of fever, cough, shortness of breath, we realized, especially with our employees, that many of them had milder symptoms. So we changed our criteria, and actually our criteria is a little bit more stricter, if you would, than what the CDC actually goes by. So because of that, we've been able to keep out a lot of people that were positive that would not have, I'm sorry.
Give an example.
Yeah, for example, so a lot of our employees had sinusitis symptoms, and we kept them out because of that and had them go get tested, and then they ended up being positive. Now, if that was just, if we were going by that strict criteria, fever, cough, shortness of breath, they would have been allowed into the facility, and then they would have been a carrier to potentially spread it to the inmate population. So we upped our criteria, if you will, to include about 12 symptoms, that if they answer any of those, or if they have any of those on their screening form when they come in, they're not allowed into the facility.
Mr. Caskey?
Thank you, Mr. Chair. 550 tests of inmates, is that correct?
Yes.
And 108 of those were positive?
129.
129. 129 divided by 550 is 23% positivity rate in the population. I think statewide,
Not the
even with
population, just the tested population.
the tested
Of
population.
the population, it's under 1%,
Got it.
0.5% roughly.
But you've tested 3% of the entire population.
We have.
What, if any, concern does that raise, and how could we address it, given the fact that that is, I think, the latest on the population writ large, and their percent positive was like 14.5. So you're, an order of magnitude more, or seeing a higher positive rate among the population that you've tested.
Well, we test people with symptoms.
Yeah.
I think the question that I'm trying to formulate here in my head is, it would seem that if the percent positive among the tested population is wildly disproportionate to the population writ large, that would give rise to a concern about increasing testing, or no? Why aren't we testing more people than 550 out of 17,000?
Well, we're testing symptomatic people, but you're starting to get in an area that is under current litigation in federal court. I think it's best if we just leave it at that we're testing symptomatic people at this time. We get about 100 tests, rapid tests from DHEC, which take about 15 minutes to get the response. Currently, that's our policy. That's a recommendation from DHEC and my professional staff, and that's what we're doing.
Well, what was the recommendation from DHEC? Only test
We do not
symptomatic
have-
folks?
We do not have a recommendation to test everybody.
You do not have a recommendation to test everybody?
Correct.
And so can the department, as a policy matter, does it have the authority to sua sponte create its own decision? Would
Yes.
And decline to do so, right?
Again, this is, I feel like I'm being a little deposed here. This is under current litigation. So we are following DHEC's.
Right, I'm not trying to depose you. I'm just trying to decide as a public policy decision, do you have the authority to do it? That isn't,
Correct. Just like our Hep C, and there are people that can refuse, but we tested, Melanie, you're in charge of that. How many people we tested for Hep C?
The last count was about 14,000 were offered, and about 12% have declined.
I would love to have a long conversation with you about this, but just because of litigation,
Well, I appreciate the litigation shield. Oftentimes folks who come up and talk with us like to pull that out when there's questions that I
it's not a
think.
shield,
Here-
it's the
here's-
actual truth. We're under current litigation. I might be sued personally on this, so I'm being very cautious right
I
now.
can appreciate that.
Have you been sued?
My concern is, so tomorrow, the Senate's going to take up CARES Act funding. One of the things that can be funded under CARES Act funding are costs that were incurred as a result of COVID-19. In fact, that's the principal thing that is funded through specifically the Coronavirus Relief Fund, of which we're going to allocate, I anticipate, somewhere between $1 billion and $1.2 billion this week. If the concern is that, my concern is if you don't have the tests or you don't have the resources to conduct the tests, then that's the thing that we need to know, and that's what I'm trying to get to. If it's just a decision that you didn't do it because you didn't have a recommendation, okay, but again, we're going to dole out $1 billion something. If we need to put more money towards you having access to tests, then that's what I want to know.
Right.
I'm not trying to be unfair, you know.
I get it, and I wish I could answer, but I've just got to be very cautious. As a lawyer, I know you understand this. We're under a court order for mediation right now. So it puts us in a tough spot. Puts me in a tough spot to not be able to fully answer your questions. I can see your frustration, but, again, working with DHEC and others, we will do what they say. I'm going to do what my experts here say, what we're relying on. As you know, we have an issue with staffing, medical staffing. Some states have tested everybody. Some states don't like that have done it. They wish they hadn't. So I really wish I could go further, but I sat in federal court for 6 hours in a mediation last week. And I would love to be able to answer your questions and have a great conversation about the pros and cons of it, but I've just got to be very cautious.
I don't know why
I think, Mr. Caskey, and Mr. Sterling, I think that we have, in previous hearings with other agencies and all, that we have stayed away from litigation and getting too much in litigation, and when they tell us that, yes.
And I appreciate that, Mr. Chairman. Again, I'm not trying to pursue this in a way that would disadvantage the state or the department in litigation. I am concerned, as alluded to, that in the space of a week, we're going to have to make major decisions about budgets and specifically resources related to COVID. And if part of the problem in a shortage of testing, where we're testing 3% of the population within SCDC, and they need more tests, then we could allocate money to that. But I don't know that, if that's the problem or not, because we've got this litigation problem. And so, instead we're going to talk about buying hotspots for schools. And anyway, thank you, Mr.
I
Chairman.
share your frustration. I wish I could
Thank you,
talk more
Mr.
about it.
Caskey. Thank you.
So if an employee has worked in a housing unit, the housing unit is placed in quarantine, all inmates are housed in the unit are monitored twice a day, ensure that they have not developed symptoms and do not have abnormal vitals. All new intakes, this is intakes are screened. We stopped intake for a while. We actually moved intake from Kirkland down to Lieber because we had such an outbreak at Kirkland at one of our intakes, so our cadre, so we had to move it. And Mr. Caskey will be happy to learn that we were able to actually speed up intake at Lieber, and we're going to be asking some tough questions of Kirkland as to why we were able to do it so quickly at a satellite place. And I think those questions are being asked right now, so we anticipate speeding up our intake. If all new intakes are screened prior to coming in, detention centers, we're not getting a lot of folks because there's not a lot of court. We may get some guilty pleas and things of that nature. Our numbers have actually come down. I think when this started, we were over 18,000, just over 18,000. We're just over 17,000, and as of July 1st, we're probably going to be in the 16,000s. Considering what was done with sentencing reform, oversight, and everything else, where we were about 23,000, that's a significant drop in our prison population. If they have signs or symptoms, they are immediately isolated. If they do not, they are placed in quarantine for 14 days. During this time, they are monitored for the development of symptoms, and their vitals are taken twice a day. Co-pays for medical have been waived. This is done to encourage the offender who's sick to come forward if they have any symptoms. SCDC staff are instructed to call medical if any offender appears sick or has complaints consistent with COVID. If offender tests positive, SCDC performs contact tracing to determine what other individuals the offender may have been in contact with. The offender's living unit is placed on quarantine. The individual within that unit are monitored twice a day to ensure that they are not develop symptoms and do not have abnormal vitals. We've asked the National Guard to come in and help us with this, and they're checked twice a day at our facilities. How many facilities are still on quarantine? Is it 2?
3.
3.
That the National Guard is helping us with, but 4 total.
4 total. Any employee who has been in contact with the inmate is notified and told to self-monitor twice daily. Offenders who test positive will be transferred to one of the designated isolation units. These units are buildings that are separate areas from within the institution. They have limited movement in these units. Only a small number of designated employees work in these units to limit a number of people entering and exiting. Quarantine dorms. When a dorm is placed on quarantine, anyone who leaves their cell as a dorm worker, helper is tested for COVID. The National Guard has been helping, as I said. Preoperative testing is done, guided by individual hospitals and physicians. So if people go out for surgery that they need, they're tested. Since the beginning, SCDC's medical staff has been on several calls with organizations. SCDC's weekly calls with Prisma Health discuss currently hospitalized patients and to anticipate inpatient needs. Our constant communication with DHEC patients to share contact tracing. Dr. Kunkel and his team, behavioral health services and resources for staff, internal, external services are provided for staff, including critical management. This can be stressful. It can be scary for folks to come into a facility that they don't know. We've got a staff hotline. We've got a prayer line, employee assistance, EAP, crisis response intervention hotline, the American Foundation for Suicide Prevention. Helpful links to available online resources and articles are provided. CDC tips for coping with stress and anxiety, a letter to the families about the crisis, stress management, how to cope with anxiety, living in uncertainty. Self-help tips were provided to give employees basic tools to cope stress management and anxiety. As you can
Director
imagine.
Sterling,
Yes, sir.
when you have someone that's in quarantine and they are positive, do you notify the family daily of their progression and how they're doing? How often do you notify them?
Yep, well, several ways. So the individuals that are in quarantine and isolated units, they're allowed to make phone calls. And then we also have, through programs, our chaplains also keep family notified when they call in and have questions or concerns about their loved ones.
So you don't have anybody that's in the Department of Corrections that are so sick that they can't make phone calls themselves?
When they go into the hospital, that's when our chaplains will notify the family and keep them updated about, with their progress, excuse me.
Okay, not the Department of Corrections hospital, but the public hospital?
Yes, sir. Community
And
hospitals.
it'll be our chaplains that would
Right,
do that.
and the doctors there notified, talk to them too
They
about
call-
the
well-
progress?
Our utilization nurses for that discuss situation, well, our patient situations at the hospital, they also keep in contact with our chaplains. So when they find out feedback, if somebody's doing poorly or if they're getting better, they would provide that feedback to the chaplains.
Thank you.
Behavioral health services, there's a reentry checklist provided by the Council of State Governments, Justice Center, and National Sheriff's Association, includes guidelines pertaining to COVID, mental health, substance abuse disorders, our resource guide for coping with COVID-related stress and fears. Mental health officers have been utilized to conduct periodic rounds, general population when feasible, assist inmates who are seeking advice, guidance, coping with stress. I mean, this is stressful for folks that are incarcerated too. It's not just stressful for, everybody that's not incarcerated or staff, but I mean, there are fears. So behavioral health service modification, outpatient level services have been provided via telepsych, including counselor and psychiatric sessions. All residential program services are continued on site for 30 days with modification to group size. After 30 days, groups were discontinued. Only critical services were provided to on-site to include crisis services, daily counseling, routine RHU rounds, one-on-one counseling, psychiatric sessions were moved to tele-psych to limit contact where possible. All mental health officers remained on site. All psychiatric hospitals continued as usual except for group activities. All addiction and recovery services were suspended. Division of Operations is our prison. Started daily briefings with our executive staff, associate wardens, key staff members, share updates and talk about what's going on. Identify and set up locations for quarantine dorms, which we've talked about. Restrict institutional activities, but we are keeping, the places that are not on lockdown for COVID, we are keeping there, allowing them to go out and rec and eat and things of that nature. Some places have gone on total lockdown for their entire population, and we're not doing that. Prepare for alternative transportation plans for inmates to be released needing transportation to the Greyhound station. Those bus lines were temporarily, I think they're back up now, but we had to know, how to get them to where they were going. We couldn't just drop them off because Greyhound shut down. Implemented alternative release for returning citizens to maintain social distancing, limited public access to the institutions. So families were used to show up and come in. Now we're sort of delivering them in a parking lot to folks. Made efforts to educate inmates being released on COVID by providing them with written information on precaution, testing sites, hand sanitizer, and mask upon release. Incarcerated inmates were provided 2 masks each and posters in housing units. Reached out to DOCs across the nation to find best practices. We early on we met with the National Guard to prepare, and that bore a lot of fruit because they were able to help us, their medical staff, come in and check. Used our search team where needed for hospital duty, transportation. Revamped our training schedule, utilized technology institutional training lieutenants to implement 1-week orientation and NeoGov at the institution. Trying to do our training remotely now. Programs reentry rehabilitative staff. This is Miss Staley's area. Face-to-face instruction, GED testing, WIN, and tab locator for reading. Math levels ended. Education packages were initially provided to continue activity for all schools, both core subjects. Polycom digital system was used to deliver virtual instruction in the 17 schools. Zoom was used to deliver virtual instructions. What we didn't want was education to stop. So like the outside schools, we're doing everything we can to continue the education. Video lessons developed by instructors for vocational classes were provided for students, inmates. Packets were continued in 2 schools. Teachers were allowed to telecommute, provide daily classes virtually. Education GED staff testing resumed at district level in June. Just this month, 1 high school diploma was awarded at Tiger River. 10 GEDs were awarded at those institutions. Obviously, we'd like to do more, but we've got to balance the number of folks coming in versus the safety of the folks that are incarcerated. Apex learning, professional development was done. TTL learning, Fresh Start Vision, men in transition, curriculum and I-pathways and supplemental material. There's more stuff that we've done, as you can see. Programs we're looking for grants, about $7.5 million in grants to aid our services. During COVID, provided the following services: inmates, family members, notification regarding COVID. To your question, Mr. Chairman, update families if inmate is quarantined or hospitalized, as well as when they return to SCDC for normal housing. Prayer line for staff support, pastoral counseling for inmates in SCDC, well-being communication with staff, keeping volunteers informed on the status of operations because they can't come in, critical stress management, increased critical stress management via video and telephone, provided support for 91 employees experiencing COVID-related issues, collaborated with our mental health services, developed list of staff wellness resources and add to DMH crisis hotline. Access to institutions, all persons must complete. And one thing that we did was we said, if you're critical to the safety and security and health, mental health of the institution, you can come in. If you're not, you need to stay out. So we've severely limited the number of people come in because those are going to be the carriers. Those are going to be the people that are out in the community that bring it in. All persons must complete screening form and have a temperature reading prior to access to our institutions and property. SCDC began using an iCheck app, which Just as an aside, I was on a phone call with directors from across the world a week ago, and they're interested in that iCheck app that our IT folks, Oscar, developed. Each access point to our facility is required to have a staff member using the iCheck system, ensuring no staff member our facilities who are not cleared and due to travel exposure, things of that nature. So if you travel somewhere, or if you've had secondary exposure to someone that may have it, then it goes into an app, it goes into a database, and we share all that to make sure that people can or cannot come in. After selecting the iCheck application, it will bring you to this screen. From the drop-down selection, choose your institution, place of work, headquarters, select the arrow, iCheck. After selecting the arrow, move forward, you will be brought to this screen. If an employee has a barcode, the badge, and that's what I've talked about. And employees, you can enter the ID also. And this has stopped, I don't know how many people from coming in, because people will show up and say, hey, I'm cleared, and they will not be cleared. So, and then there's denied access or pass. We've got a COVID call team that we started. SCDC set up a staff assistance call team to answer questions and concerns that may arise in initial medical screenings, travel concerns, or development of symptoms. Over 90 SCDC staff from all divisions volunteered to man this team, which went live on April 3rd. Team members make the initial return call, left a message of the employee call line. A medical professional or call team manager reviews the information, will approve a return work date once monitoring. So these two ladies sitting up front here, and Dane have worked on this, but they've worked literally tirelessly and sometimes almost around the clock on this call team and checking on folks and staff. All staff are placed on quarantine due to travel, exposure, illness, or monitored through the Power Apps. COVID-19 team follows up. See selected slides, standard operating procedure. And I can go through this if you'd like, but I mean, there's a whole app on what we do, case monitoring, and monitoring entries. And this wasn't here a month or two ago. That's why, as you can see, people from across the country and other countries want this. And then there's a follow-up, just kind of moving ahead. And there's a whole thing where you put information in on the employee. They're monitored daily. They're called. We're using employee already being developed symptoms. And this is working because it is stopping people from coming in, as Dr. Clark said, that may be borderline, and we're telling them you need to go get tested. And one of the things that Melanie Davis told me is she likes talking with these folks because she can hear them and listen to them and say, okay, you do need to get tested. And I mean, there should be a phone growing out of both their ears, probably two, because they're constantly on the phone with folks. Again, I mean, I'm very proud of what these folks have done during this time. I can't say enough about my staff. I mean, they have worked tirelessly. Some of the other things that aren't in here that we're doing, we bought foggers. Georgia had foggers in our conversation with other states. I'll call and say, hey, what are y'all doing? We'll fog the living areas once a week. National Guard went over to Georgia and trained on it. They then came back and did a train the trainers, T for T. We trained our folks, and they go and fog the institutions, each living area once a week. We've got mats. We've got a robust system of checking people when they come in to the facilities. And that's what we're doing, but it is truly a team effort, what we're doing. And this is, I mean, just talking with other directors, past directors, nobody's ever seen anything like this. I hope nobody sees anything like this in the future. It is a lot. It's very stressful. It's exhausting on staff. I know the population is probably exhausted and scared. If we're trying to assure them that we're doing everything we can. I think they were stunned when we gave them the masks, because I don't think they thought we would do that. We're cleaning every 2 hours. I mean, we're doing everything we can, and we're learning as we go. As things come up, for example, you know, at first we thought, okay, we can take them to this designated facility outside medical and everything will be fine. Unfortunately, sometimes people decompensate so quickly, we have to take them elsewhere quickly to get them help. So that is what we're doing. And again, my staff has stepped up, and I'm incredibly proud of what they're doing. I'm sure other directors are proud of what their staff's doing too.
When you say they're cleaning every 2 hours, what are they doing?
Anderson, you want to talk about that? I'm going to let Mr. Anderson talk about that as I step away for a second.
I'm Joel Anderson, Deputy Director of Operations. What we did first off, starting out, we started a real robust cleaning protocol for all our institutions. We disinfect, we use bleaching water, we use chemicals called Wexide 128, which is EPA registered to kill the virus. So anything we can, what'll happen is over the loudspeaker, it'll come out of the loudspeaker, it's time to clean. We clean every 2 hours, an announcement goes out by the warden or her staff, and we clean the entire living area. Inmates are given cleaning supplies for their cells, and they get to clean inside their cells. But the rock is cleaned every 2 hours. Inmates, if they need hand sanitizer, it's available to them. We made that available right from the very start. And if they need supplies to clean their cells, or they need additional supplies to clean their cells, we've told the wardens all of them make it available, and they've done a good job. Our housing units are probably cleaner today than they've been in a long, long time. But we started that early on, probably the first time back in March when we found out about the virus.
Any members have any questions for Mr. Caskey?
Thank you, Mr. Chairman. The question that comes to mind is with the increased cleaning, that would be an increase in consumption of cleanables, cleaning materials. Do you have the resources necessary to sustain this? And if so, how far into the future? What do we need to consider, if anything, in terms of resource allocation?
I think, to that question, I think we put in a request, about 1.6 million, just up till now, through, I forget who asked us. I'm not sure if it was y'all or the governor's office. I think it might have been Senate. Did Senate ask us? Both. House and Senate. So y'all asked us, and we've responded with what our needs are currently, with probably a little bit of a projection of where we're going. So it was 1.6. And that probably includes hospitalizations and things of that nature also over it. Yes, sir.
There's Clary.
Thank you, Mr. Chairman. Director, let me go back to what we were talking about a little bit earlier and see if we, on this issue of testing, and understand the litigation that you're up against, do you have access to sufficient testing through other governmental agencies, if you need it?
We're getting 100 a week right now. And that's a rapid test, which gives us an answer in about 15 minutes.
Mm-hmm.
And we're always asking for more.
Okay, thank you, sir.
Mr. Jefferson.
Mr. Director, I hear you applauding Ms. Davis as well as Dr. Clark on their performances, but do they have staff assistants? Do they have members to assist them in their occupations?
Yes, sir. But I just wanted to, I see them every day and I hear from them all hours of the day. So they come to mind with others sitting here, Joel and Nina, and so yes, they do. So all of our staff are stepping up during this time. It's never thought we'd see anything like this, but I'll let them answer. Dr. Clark's smiling, so I'll let her answer.
Well, I think I was just smiling because I think that is why we developed the call team. Early on, Melanie and myself were trying to answer all of the employee calls and questions, and Dane and the director basically stepped in, and the IT folks, and created this app, and it's just really amazing. And we were able to elicit, like they said, 90 people to step up and help us try to manage all those calls. I think, am I wrong if I say, I think it's over 5,000 calls that we've managed, even since the app was developed. More than that prior to the app being developed. So it's just, there was so many calls, but it was just, it's basically a testimony of how we were able to pull together all the different disciplines to basically counteract what was happening with our employees. So it was really nice to see everybody come together and do that.
And Mr. Jefferson, if I could just say, we're tired. This is a lot. We're
Yeah,
exhausted.
I bet so.
I mean, we're not getting breaks. It's constant, but we're going to forge on as we have to. But these folks sitting behind me have worked tirelessly with their teams across SCDC to make it as safe as possible. And when we see something and when there's a change, that's recommended, we will follow that change and that recommendation, relying on healthcare experts who sit here and sit at other agencies. But this has been exhausting on staff. This is exhausting on the leadership. I know it's exhausting for the state, but we have no choice. This is what we do. This is what we do at corrections. This is what you do in law enforcement. You just keep on going and work hard, and that's what they've done here.
Thank you so much.
Ms. Dillard?
Thank you, Mr. Chairman. Thank you, Mr. Sterling, Director Sterling, and all involved for your hard work. I can see the, what I want to say. I can see it's wearing on you, but you're hanging in there, and I do appreciate that. Along with the cleaning that is taking place, have there been any, we talked a lot about facility challenges. What, if any, modifications have you had to make for COVID? Have the facility conditions in some instances exacerbated the COVID management? I think as we sit here, I know social distancing is probably a challenge,
Big challenge, yes.
but like we've got the doors open where air is flowing through. What can you speak to that, and what challenges you've had due to the facility conditions? And
I think cleaning's our largest thing. I'm gonna let Mr. Anderson, I don't know if Mr. Osborne wants to answer this, but cleaning's one of our largest things. The best things that's happened is the reduction in our population. Since the beginning of this, we have less folks coming in. That's been very helpful, because, as people come in from the county, we've got to test, and we've got to quarantine and things of that nature, but we are having a backup at R&E right now, because we're not transferring people around, and that's a conversation we're having about how do we handle this. Because the last thing I want to do is say, all right, we got a backup at R&E, we need to get people out, and then we get that one person out, and then boom, we have an epicenter at one of our facilities. So that's a challenge. We've got an old system, as y'all are very, very well aware of when you've seen it. But I'm going to let Mr. Anderson talk about the rest of that. Thank you.
Thank you.
I'm Joel Anderson, Deputy Director of Operations, and yes, ma'am, we've faced those challenges. We still have plumbing issues, we still have lighting issues. But we're taking care of those as they come up. One of the things that we did was, and purposely, I didn't want to change the order of the institution so that we didn't affect the inmate population. And the director he was pretty clear about what we wanted to do is leave it as normal as possible, recreating, letting the guys out to shower, use the phones. The director even approved 2 free phone calls for the inmates that even had restrictions for phones to be able to contact their family. That's gone over real well. He also just approved phone calls for Father's Day, that these inmates could get 3 free phone calls for Father's Day to call family. Those kind of things I think have really proved beneficial to us. I think you'll probably notice, knock on wood, I'm not going to say it too loud, but our inmate population has responded very well. Thank goodness we don't have to deal with those issues and the COVID issues. I think the inmates are seeing that we're doing everything we can. There may be a few that think we ought to be doing more, but I can tell you that we're working our tails off to keep this thing going. Maintenance issues are going to be, our institutions are 30 years old. A couple of them older than that, and so we're working on them as we can go. But I think probably the biggest challenge, Ms. Dillard, is keeping everybody informed. Okay. That's probably the biggest challenge. And so we started these COVID phone calls every day at 10 o'clock to talk to all the management staff, meaning medical, our police services, all the deputy directors, all the wardens, assistant wardens, so that they would all hear the same message. And I think that's gone over real well because they talk to the inmate population. Dr. Clark and Melanie, they've done a tremendous job. I don't know if we could have done it without them, to be honest with you. So, yeah, it's been challenging, but I think we stepped up, and I hope it goes away soon, but I don't see it leaving us.
Brian Sterling again. One thing that's very frustrating to me is this classification system. Everybody's going to be moved. We've not been able to exact that and do that, and that's frustrating because we'd be, I would say almost over halfway done. Where people would actually be in the proper. So we've overclassified at SCDC as we've discussed for years. We are starting to run. I got word from a lawyer the other day that Some of our level twos are actually being run, and I'll give Mr. Anderson and his team credit for this, like level twos, medium custody. They're not being run like close custody units. But, I mean, I wish we could have transferred all these folks, but just for safety, it's something we're looking at. We're looking at credit, because they shouldn't be penalized. So if they are a level 2 inmate and they're still at a level 3, we're looking at how to kind of properly give them the credits that they need. Working with outside entities on release is a challenge. The last thing we want to do is drop someone in the streets and they get COVID and spread it. They didn't have it in prison, but they get it when they get out. So we don't stop trying to help after they leave. And I know Ms. Staley's talked about that, but I know our folks on medical have talked about that also.
Dillard, is that, Ms. Dillard?
Yes, I'm done, thank you.
Okay, thank you very much. Are there any other questions? Ms. Sterling, I watched you on TV when you testified before Congress, and I want to thank you. You did a great job representing South Carolina. So I know it was a difficult time, difficult conversation, but you represented us very well, and so thank you very much for that.
Thank you very much. I will say that one last thing, I do believe we've got the lowest recidivism rate tied with Virginia in the country right now. Those are people coming back to prison. That's a lot of what Mr. Anderson and Ms. Staley have been doing and working on, and y'all's funding has tremendously helped that with reentry services. So that's a good thing to have, as you heard, so thank you. Do I just clean the whole thing, or what do I? Okay. I'm going to leave it on so the next person doesn't have to touch it. Yes, sir.
There's one individual that has requested to testify before the meeting, Ms. Teresa Bebo. Is there anyone else in attendance that desires to testify? Please come to the side of this desk where we're sitting and give your name to the staff. Okay, Ms. Bebo, if you'd come to the podium. Please turn the microphone on when you get here. If it's not, it's on already. State your full name and the county in which you reside.
Teresa Bebo, and I reside in Dorchester County.
And you have been sworn.
Yes, sir.
Are you currently involved in litigation involving the Department of Corrections?
No, sir.
Do you understand this committee cannot intervene or attempt to impact any judicial matter or quasi-judicial matter such as administrative proceedings?
Yes, sir.
Do you understand your testimony today is limited to 5 minutes?
Yes, sir.
We're happy to hear from you at this time.
Okay, to the House members, thank you for letting me have the opportunity to speak to you today about the concerns I have with the South Carolina Department of Corrections. Some of what I must speak about are the same topics I or others have mentioned to the House members in the past. I'm bringing these issues to you again because there's been little to no results regarding the changes that were supposed to have happened. But before I do that, I would like to request on behalf of the female incarcerated in Camille Graham. They recently had a young female collapse and died. The other incarcerated females had to carry her body to medical. The concern they have is this is the second female that's passed in a year. No medical or guards are coming to help them. They would like to learn CPR so they can render aid when the guards or medical are not available. This is a reasonable request, and I thank you for considering it. Second, we have brought up the subject of showers, medical, mental health, and so many times I'm sure all of you are tired of hearing about it as well. We get told time and time again that these problems are being addressed. If these issues are being addressed, we're still not seeing any results. There's still issues of people needing medical. They're being ignored when requesting for the medical. The incarcerated cannot get to the kiosk to ask for medical. They're locked down. The guards and medical do not have good communication regarding a medical request. This is the difference between a life and death situation. Some of these incarcerated individuals are dying due to not getting the medical they need. The mental health is not being met. They have not had any mental health workers for several weeks in some of the prisons. This COVID-19 has created stress for all of us around the world. But imagine what it's doing to the incarcerated individual that have to rely on SCDC to get the mental health they need. Showers continue to be a problem in some prisons, like Evans, are not getting showers but 2 times a week. To fight the virus, they must maintain cleanliness, and showers are particularly important part of this. Third, last summer was very brutal and hot, and we're starting to get the heat now. The AC in most prisons are still not working correctly. The window coverings that were supposed to come down has not happened either. The SCDC had cut small slats in the metal coverings, but the light does not get inside the prison cells. And it has been ongoing for a couple years with no results. We would like to see results. We would like to see all the metal coverings taken off the prison buildings to let natural light in. And fourth, in one of the meetings last year, the subject of 2 meals on the weekend was brought up to the House members, and they all agreed it was not adequate to feed the incarcerated 2 meals on the weekend. So we have no results. They're still getting 2 meals on the weekend. And I would like to see if we can readdress getting them 3 meals on the weekend. And I'm concerned about the pregnant incarcerated, they're getting enough nutrition for their pregnancy. And we hear time and time again that SCDC is short-staffed, and this is the reason these issues are happening. The incarcerated individuals protected under the Constitution of the United States that have the right to medical, mental health, showers, meals, and natural light. We need to see results, and I'm asking the board members to please address these concerns and act in making SCDC accountable for not providing the most basic needs for these incarcerated individuals. And that's pretty much what I had to speak of today, sir.
Okay, before I open the floor to questions from other members, and I want to let you know, Ms. Bevo, we appreciate you and others that come to testify before this committee about your concerns. As you noted, many of the items you mentioned today, you and others have previously testified about, and I believe if you review the potential findings and recommendations, which are in the meeting packet posted online, you will see many, if not all, of these issues are addressed. One issue I know that has not been addressed, because today is the first time anyone has mentioned it to us, is the possibility of training some of the inmates in CPR, which I'll ask Director Sterling about when members have finished with any questions they may have for you. So thank you very much. Do any members have any questions for Ms. Bevo? Hearing none. Seeing no questions, thank you very much.
All right, thank you.
Director Sterling, will you or your medical personnel for your staff come to the podium, and what are your thoughts on the feasibility of teaching some inmates CPR?
Yes, sir. No, it's fine. Sorry. Brian Sterling, Director. We're happy to look into that. Don't want to give a commitment today, but we're happy to look into that. I know we do have hospice workers and things of that nature, so I'm not sure if they're already getting that training or not. I don't know if anybody knows, but happy to look into that.
Okay, any questions? Judge Cleary? I had to call you Dr. Cleary.
Thank you very much, Director. In looking at the issue of pregnant female inmates, are there any special accommodations that are made for them regarding nutrition, which was alluded to in Ms. Bevo's presentation?
I'm sorry, hold on one second. I want to get you a specific answer. Can you answer that?
And I guess another question,
She just said
I guess another question would be, how many inmates fall into this category?
There's 4 currently. I'm going to let Dr. Clark answer specifically. I know we work with MUSC and, USC and others, so about their nutritional needs.
Yeah, right now, we've had several discussions with our OB-GYN physician who cares for these 4 ladies, and he has not suggested for us to do anything above what we are already doing for our normal population, for our normal female population, as far in regards to nutrition or COVID screening or anything. So we had a long, in-depth conversation about their needs, but there hasn't been any additional suggestions or recommendations for, over and above what we're doing.
We can follow up with him and get back, right y'all back what we're doing, and if we should be doing something different, we'll
All
do
right.
that. Dr. Clark will do that.
Thank you.
Thank you,
Ms.
Mr.
Dillard.
Thank you, Mr. Chairman. Director Sterling, in Ms. Bebo's comments, she talked a little bit about, facilities, condition of facilities, and so I'm going back to that. I think it's been really public about the air conditioning at Trenton Correctional Institution, and when it may or may not be repaired. Can you speak to that?
Yes, sir, yes, ma'am. I know that I'm gonna have Mr. Osmer come up. We're trying to get the part. These are old buildings. I think we have one dorm that is out. One thing we've done is we've purchased, a portable chiller so we can move it around because we have such a need with air conditioning. We do currently have, Trenton is out. I think it went out on Wednesday or Thursday. Wednesday or Thursday? What day did it go out? Trenton? Friday. So, it was out on Friday. We immediately tried to fix it, trying to get the parts. Why don't you come up here, sit down, Tom? This is Tom Osmer, he's Director of Facilities and Administration. We're looking at, on average, we have one chiller in use at all times that we move around, and we're gonna buy another one to make that happen. But it's been out since Friday. When you have old facilities, things like this are gonna happen. You know, and some people, we have staff that works in there too. We want them, you know, we understand that when temperatures rise, bad things can happen. So we try and try, but sometimes parts are so old, or these things are so old, it's hard to find parts to fix. Do you have anything to add to that, Mr. Osmer?
No, I think you covered it quite well.
So,
Would you turn your microphone on?
Their estimated time on when that one might be repaired?
It was, excuse me, Tom Osmer, Deputy Director for Administration. Originally, I believe it was 3 to 4 days. This morning, we asked that if we could, the part would be overnighted and we'd have it tomorrow. That's a big if, because I'm sure the part's out of state. It's a pump.
Yeah, okay, thank you.
but that should tell you something, that at any given time, at least one, if not two, of our air conditioning units are out, on how old the units are.
I'd like to introduce, I think this is Mr. Williams that just sat down. Is that who you are behind the mask? I think so. Okay. Welcome. Glad you made it. Okay, if SCDC needs to research some more on the CPR and get us a letter back to the
Yes, sir.
committee on what's going on that.
I don't see a problem with it, but obviously we can, I want to check with
Yeah, I
everybody.
got you. I got you, I understand. Okay, potential findings and recommendations. You may sit down there. There's a copy of potential study report findings and recommendations in your notebook and the meeting packet posted online. Before we begin discussion, we're going to take a short break in an effort to make our discussion as efficient as possible. During this break, members, please try to stay seated until staff has had an opportunity to ask you the potential findings or recommendation numbers on which you have questions or objections, if any. When we return for the break, we will accept the motion to adopt all those on which members do not have questions or objections, then address those on which members have questions or objections, if any. We will now take a 15-minute recess. We're back in session now, we're back out of recess. It appears there are only questions or objections about the following findings and recommendations. No objections on the findings, recommendations, number 19, 46, 54, 56, and 58. There's going to be some discussion on it. And then those will be voted on individually if we vote. 59 was erased. The person who had a question on 59 withdrew it. Okay, before discussing those, Representative Clary, is there a motion that the subcommittee study report include all other findings and recommendations as provided in this document?
So moved.
Representative Clary has made a motion. A second is not required, but a roll call is required. Is there any discussion before the vote? Hearing none. Staff, please call the roll.
Representative Caskey. Representative Clary. Representative Dillard.
Aye.
Representative Jefferson.
Aye.
Representative Johnson is not present. Representative Williams. Representative Talon.
Aye. Now to the discussion of the questions. There's a question or objection about recommendation number 19 on page 180 from Representative Caskey. Representative Caskey.
Thank you, Mr. Chairman. The question I have is just because probably, Director Sterling, if you or may take someone else, my notes were unclear when I look back on this question because you have the automated request system, and I believe the explanation was that when an inmate or offender, I noticed there was a change in nomenclature during the presentation earlier, but when the inmate says I have a request for, it's a facility repair or a medical thing, it's then sent to the respective functional area within the department to handle that. My question was, or at least what I couldn't recall in our discussion, was whether or not there is a prioritization within that functional area. So, for example, if it's a medical complaint of some kind, a request for service because I'm having chest pain is different than my ankle hurts. And so my question was how does that, is there a prioritization system within these functional areas, and if so, what does that look like?
So I'm going to read what Ms. Hale, and then I'm going to have, before I go to Ms. Hale, but also with Dr. Clark being new, I think we can help answer that. Current schedule is to have tablets in all institutions by September. GTL, which is the supplier, believes that the goal will be met. GTL is currently working with NextGen, which is our medical, to have a handoff process for applications development for medical requests, behavioral health, developing a triage system, and the institutional level prioritizing emergency medical, mental health needs. For operational requests, that'd be under prisons, GTL is exploring the possibility of placing weighted averages. So I guess, just, we're looking at it, but I'm going to have Dane kind of give a more specific answer, and then if you have any follow-up, I think Ms. Clark, Dr. Clark, sorry, can answer, because a lot of them do end up when they don't get met in our office, and I'm usually having the conversation of why is this happening.
Thank you.
Just introduce yourself. Dane, introduce yourself.
Sorry, Dane Hale, Executive Assistant to Director Sterling. GTL's working with the possibility of placing weighted values on the request for buzzwords and catchphrases that will be reviewed by the Institutional Clearinghouse, Medical Services, or Behavioral Health Services for handoff to necessary staff members. The app will also allow SCDC to initiate a request to staff to an inmate if there are any concerns that SCDC feels needs to be addressed. I've spoken with Dr. Clark and Dr. Kunkel, and they are prepared to address how they will prioritize medical requests and behavioral health requests, and then the wardens will come up with a system on how they will prioritize the needs of an operational request.
Thank you. That's helpful, and that answers generally the question, which is the complaint I hear is such and such is an inmate and says that nobody's done anything with my complaint or my request, and so my question is just to ensure that there is some system for, because there's a finite amount of resources that can be allocated in terms of probably time to go through these things, but that there are certain ways to get to, again, the more pressing things in a more pressing way. So I don't need to belabor the point. I'm just interested that it's happening. And I would just ask that to the extent it is consistent with the department's policies with regard to security and other things, that in the interest of transparency, that is then shared in some form or fashion with the public so that they can, say, okay, well, I understand what is happening here or will happen after this endeavor.
And I think the tablets are going to be a game changer in many ways. I know there's been some concerns with those, but it's going to be a game changer in many ways, and that's going to be one of them.
Okay, thank you. That's the extent of my question. Thank you, Mr. Chairman.
Mr. Caskey, would you like the recommendation revised?
No, sir, I don't think it's necessary.
All
I
right,
think
sir.
it's addressed.
Does anyone else have a question on this? Seeing no other questions, is there a motion that the subcommittee study report include finding on recommendation number 19? It's moved by Representative Williams. A second is not required. A roll call is required. Would please call the roll. Kathy?
Representative Caskey. Aye. Representative Clary. Aye. Representative Dillard. Representative Jefferson.
Aye.
Representative Johnson is not present. Representative Williams. And Representative Talon.
Aye. So carried. There are questions or objections about recommendation number 46, page 186. Mr. Caskey.
Mr. Chairman, I don't have any questions. I just, I don't support that particular recommendation, and so if we're going to vote on that recommendation separately, I just wanted the opportunity to do that.
Okay, would you like to talk about why you don't, in case?
No. No, Mr. Chairman, I think that given the limited set of criminal offenses that are designated as no parole offenses, reducing that number to 80%, or 70% from 80%, I'm just not convinced of the argument, the need to do that.
That's not what we're doing. I'm sorry.
Sorry.
They would be allowed to go work. It's not reducing 80 to 70 on the sentencing. If you had 70, and you didn't ask a question, but I just want to make sure everybody understood. So what we'd be doing is right now, if you've earned your way down to 80%, you can go out and work. You're already probably at a work camp, a level 1, because of behavior and everything else. So we'd be allowing somebody at 70% to go out and work. Right now, the law says you have to be at 80%. So it's not a sentencing thing; it's a go out and work thing.
Yeah, well, good. Well, I could support that. Yeah, all right.
Okay.
So, Mr. Chairman, unless there's any other question or comment about recommendation 46, I would move that the committee adopt recommendation 46.
Motion is made to adopt.
My stupid comments notwithstanding.
Recommendation number 46. Kathy, call the, any questions on that?
Thank you, Mr. Chair. Not a question, but basically what I'm hearing from this, it would actually give more inmates the opportunity to go outside and work. Is
Yes,
that
sir.
correct?
Yes, sir. That's a benefit of the new, as Mr. Anderson pointed out, benefit of the new classification system.
Okay, thank you.
There are no other questions. Kathy, please call the roll.
Representative Caskey. Aye. Representative Clary. Aye. Representative Dillard.
Aye.
Representative Jefferson. Representative Johnson is not present. Representative Williams. And Representative Talon.
Aye. There's a question about recommendation number 54 on page 188 from Representative Dillard. Representative Dillard.
Thank you, Mr. Chairman. I did have some questions, and the questions have been kind of cleared up by the rationale, the additional rationale about how many states actually have a minimum age of 18, which I see here is 23, and a mixture of some other ages. My concern was, all 18-year-olds are not created equal. I do know that. And I think it takes a level of maturity to do this work. And I guess my other question would be, can an 18-year-old go through the Criminal Justice Academy? I mean, I know that you are training your own
Yes.
folks, but can an 18-year-old go through our Criminal Justice Academy?
No, ma'am. They can't go through the South Carolina Criminal Justice Academy, but with this change, they could go through our academy.
Uh-huh.
So being a road law, and we're not asking for this change for Class 1, we're asking for this for our correctional officers. So this would not be universal. This would be for correctional officers, not for the Criminal Justice Academy, which is Class 1.
Okay, so they'd have to grow into that if they were to
We hope they'd stay.
stay.
That'd be the goal. But if they wanted to, they could then transfer to the Criminal Justice Academy. Y'all have an officer here, and I used to work with his wife, who grew into that, I guess. And we're still not happy he left, but he was working downtown and doing a great job. He works for one of the Sergeant-at-Arms offices. But he's not 18 or 21. He's older than that.
Can cadets go through the Criminal Justice Academy now at 18? Police cadets? They cannot.
What?
18-year-olds go to our academy.
Right. Not the South Carolina Criminal Justice Academy.
Okay.
Maybe Mr. Anderson wants to.
Yeah, right now, Ms. Dillard, to answer Joel Anderson, I'm sorry, Deputy Director of Operations, but to answer your question, we currently have over 100 cadets now between the age of 18 and 20. And they do a great job for us. Matter of fact, last year, a cadet for the very first time was selected as Officer of the Year. So okay. Yeah, so a correctional officer at age 21 is a certified correctional officer, can do it all from transportation carrying a weapon. The cadet can do it all except for transportation carrying a weapon. So what they can do is they can help us in the institutions, work in gates and work in other places, cafeteria and all that other stuff while they're learning. The first 3 years right now, because they're not certified, it's limited as to what they can do. But in this case, if it was made to be 18, and I know from experience, I started when I was 18, so I know people can do this, right? So that was 42 years ago. So I'm just thinking that, my thinking is an 18-year-old is very capable if they're under the right structure and the right training, and that's what I believe. I think that 21 doesn't make you any different than age 20. I think those guys learn a lot of responsibility. And what we would say, even if that, we would hire them in. If they wanted to go to law enforcement at age 21, at least we've had them 3 years. We can work them for those 3 years. So.
And she said a cadet was Officer of the Year, Correctional Officer of the
Yes,
Year
sir.
last year. How's that chosen? What's the criteria for that?
They're all, I'm sorry, sir.
It's a very secretive process.
The names are submitted by the wardens of the institutions, and they're voted on by a panel at headquarters, and the director has to sign off on it. And so, I mean, this young man has showed that he can do it all. So,
Okay.
he's no longer a cadet, by the way, so.
Good.
We also think that, there's 100, but the pay's different, so we think it would be more attractive if you're allowed to be an officer as opposed to a cadet. And as you see, other states are doing it. And with our staffing needs, we're looking for everything we can to get as many folks in and to allow them to do other duties. Correctional officer duties.
Mr. Williams, you have a question?
Thank you, sir. My question deals with, is these cadets are in a pool of cadets, or are they just part of the employment
Well, they work in an
establishment?
institution.
Yeah, I know they work in the institution, but, so in other words, I'm just curious about how many of these cadets end up going straight into the officer.
How many do we retain and then they end up
Yes.
as officers?
Yes.
I don't have that number, sir. Mr. Osmer may, but I don't.
So.
We can get that and let you know.
Okay, because I'm just curious, do you have a top in terms of a limit of how many cadets you can take?
That's another question for Mr. Osmer, but the answer is yes, sir. We only have so many cadet positions that we can hire.
Okay. And I'm just curious as to how many of those cadets actually go through and end up being armed transportation, armed carrying
We're going to try to
weapon.
get that answer before we're done.
Okay, thank you.
Yes, sir.
Thank you, Mr. Chairman. I'm good. I mean, I do know the rationale, but it makes me feel better have a little bit more conversation about this.
Yes, ma'am.
All right, thank you.
Any other questions? Seeing none, is there a motion that the subcommittee study report include the finding or the recommendation on number 54?
Mr. Chairman, I'll move that the recommendation 54 be accepted.
Motion is made by Ms. Dillard. Call the roll, please.
Representative Caskey. Representative Clary. Representative Dillard. Representative Jefferson. Representative Johnson is not present. Representative Williams. Representative Talon.
Aye. Okay, the next, there's a question about recommendation number 56 on page 188 from Representative Dillard. Representative Dillard.
Yes, sir. Thank you, Mr. Chairman. So I needed a little bit more clarification about, the costs are pretty apparent, what you're trying to recoup. I guess this is more or less a process question. So currently, when offenders are being released and they come under the underside of Triple P, or they
Sometimes. Sometimes just max out.
sometimes max out.
They don't
So
have any supervision.
currently, if there are costs that you're trying to recoup, does that follow them to Triple P?
I'll let Mr. Osmer.
Or, what's happening now, I guess is what I'm trying to get a handle on, because I'm really concerned about, I know we need money, but I'm concerned about the offender as well, because a lot of them are strapped already with child support, this, that, and the other, and then, it's a vicious cycle. And then we got them back because they can't pay these fees because maybe they don't have a job or what have you. So I'm just trying to get clarification on what the process is now and how much more of a burden this would be to them. I understand our side, we need money. So can somebody speak to that, please?
The way I understand it is, once an inmate has left DOC, that there's no mechanism in place to collect any restitution that might have been placed on his account while he stayed at DOC. And that's what this is asking for, a way to let that restitution follow, because if, mainly it's a damage to the facilities or damage to, willfully damaged or destroyed things, and that's what it's referring to. The only way, I think if you look, what we're proposing is we would go through the governmental enterprise accounts gear, and that way it does not hurt an individual unless they have meaningful income.
In other words, if they have a tax refund and they owe the Department of Corrections the money, then that money will be sent to the Department of Corrections instead of returned to them for a tax refund, right?
That's the way I understand it works.
If they have no tax liability, you don't get any money back.
That's correct.
So they're not going out and garnish their wages, but they are gonna garnish the tax refund. if they
Yeah,
have it.
like set off that. Okay.
Any other questions? Mr. Williams?
I'm just trying to figure out how these costs occur and what are these costs for? Why would they owe you?
It could be for destruction of property, it could be, just like detention centers currently do, it could be medical costs, and things of that nature. If they tore their room up, if they, I don't know, had a medical cost or things of that nature, and then they had a tax credit, then in the law, D says detention facilities can do it, so we're asking to do what detention facilities, the 46 county detention facilities do, basically.
Okay, I can understand the cost behind destruction, you know, if someone damaged property, you know, but the medical piece, I just kind of it's hard for me to understand, because I feel that that shouldn't be a cost on their, you know, if you are taking care of these guys, they're a ward of the state, why are they paying for their medical?
Ask something, I think we passed the recommendation. right now, you can sign them up, some of them are eligible for Medicaid,
Yes, we very.
but they refuse to sign up for Medicaid, so the state is responsible for that. And if that law doesn't pass where you can make them sign up, or you could sign up for them, then this law would allow them to go back and collect the Medicaid money that they refuse to sign. Related?
I'm not sure that's.
It's unrelated, he said.
We're just asking to do what detention facilities are currently doing, what your county detention facilities are already currently able to do.
Okay. So,
Remember, it's coming out of the tax refunds, not out of their salary,
yeah.
you know.
So you're telling me each county in the state are charging medical bills to those folks who they have incarcerated?
I don't know what their practice is. I could just tell you what D of this law says. Detention facilities may initiate an action for collection or recovery of medical costs and incurred pursuant to this section against inmate upon release, state, etc. So they're currently able to do that. I don't know if they are doing that. I would assume some, just like everything. Some are, some are not.
So you don't know which counties are charging and which counties are not?
No, I don't. It says current law authorizes detention facilities to collect certain costs, such as elective medical
Right,
services.
he's asking which counties. We don't know.
We don't know.
Well, could you find out, reach out to some of the counties in the state and find out who is actually charging for medical service?
After they leave, I would assume they're
After,
charging.
yeah, after they leave the institution. Yeah.
I mean, I guess the
So-
basic
so-
question is, does the state pay for it or not?
Well, I understand that, but it seems as if, you coming out of prison with a bill. It's just like sending out folks who going to college, they coming out with a debt. A debt that they really didn't, don't want, basically, but it's a debt just by being incarcerated.
Yes, sir.
I'm already incarcerated, goodness, but coming out owing somebody is even worse, and certainly it's not like they find jobs, and I know that's one of the things I really want to, find out too at some point, in terms of how fast they're finding jobs once they're leaving the correction system, because, how can you pay for a bill if you don't have a job? So we got to make sure that, when they're coming out, they're lined up for jobs immediately. And to do that, they got to have their paperwork together. Because what I'm discovering is when they get out, and don't have a state ID, or don't have a birth certificate, that pushed them further down the road in terms of getting a job, or applying for a job, because they don't have the necessary paperwork to do it. And especially since we go into this real ID, it makes it very difficult. So I'm just curious about how long or how soon that can happen.
So the birth certificates and the ID, and I actually talked with Ms. Cobb Hunter about sponsoring a bill to get rid of the $50 fee for the violent felons to have that moniker on there to identify. It's still on there, but that was a big problem for folks leaving, trying to get that identity,
Sure.
that license. So we've done everything we can, from working MOUs with DHEC and Staley's done, to driver's license, to identifications. That's huge.
Sure.
We can
Sure.
set them up, if we can get them a place to lay their head, an identification, a
Mhm.
job, and we're working with DO, and none of this stuff was done before, to train people and get people jobs. That's what our goal is, and that's
Sure.
what some of the money y'all have given us. So I agree, and sometimes with birth certificates, we do have a problem. How much does a birth certificate cost? $12, but sometimes we've had to go to Catholic Charities and ask Catholic Charities to help out, or other people to help out.
Yeah.
But it's very difficult to get a birth certificate, because you have to have all those.
Sure.
And real ID is a concern.
Sure, because if you don't have IDs, you can't get ID. It's hard. It's very difficult, and certainly when they've been away for
Can't go
so
into federal
long,
court.
when they've been away for so long, they just don't know where to start. They don't
Right.
even know where to start.
So that's why with the money y'all have given us, we weren't doing it for level or close custody now, for example, a Lee or a Lieber, and we're starting in advance to do that. We're actually sending people to Lieber for 2 years. Kershaw, same thing. Manning, same thing. So our goal is when you leave, we're trying to make you as whole as possible, because for too long, we were putting up barriers where we were setting them up for failure, and we're
Yeah.
trying not to do that anymore. And that's why I've come to y'all, and y'all have been very good about funding, and that has shown in our reentry and our releases and the folks coming back.
Okay, well, I do want to have some conversation with Ms. Staley. We've talked and certainly want to make sure we iron all that out if possible.
Real ID is a concern.
Yeah, I know,
It's federal law, so it's.
sure. All right, thank you.
Any other questions? Your
Chairman.
motion? Judge Clary?
I move that we approve recommendation 56.
Motion is made to approve recommendation 56 on page 188. Call the roll, please. Kathy?
Representative Caskey. Representative Clary. Representative Dillard. Representative Jefferson. Representative Johnson is not present. Representative Williams
Aye.
and Representative Talon.
Aye. Okay. Okay, our next recommendation, questions about are number 58 on page 189, Representative Caskey. Representative Caskey.
Thank you, Mr. Chairman. I'm not necessarily looking at the department to explain this. I just think it's important to voice to the committee concern that I can foresee as a practical matter implementation with this proposal, which is that upon sentencing, court shall determine credits to which prisoner is entitled based on pre-sentencing confinement. The second sentence goes on to say, the court shall determine the credits and be credited on the commitment order. I think either one or two things will happen, maybe three. One would be the judge is going to say credit for time served, which they ordinarily do, but that doesn't alleviate the department's problem within calculating how much credit is to be awarded unless we were to somehow keep that responsibility within the judicial department. The Department of Corrections is going to be in the same problem they are now. Just because as a practical matter, for those who may not have ever seen this happen, when a inmate is arrested and kept at a county detention facility, he or she shows up eventually for a plea, enters the plea. There's no interface immediately available to the judge to see, okay, John Doe was arrested on January 1st and has been there ever since. You don't know unless the defense attorney tells you. Likewise, the solicitor doesn't really have the access to that information unless they call that county. And that's a fairly straightforward example. Of course, sometimes inmates are held in several different facilities along the way before the plea is eventually done, where crimes are committed across a number of jurisdictions. And so my concern is that I want to voice, not that we can't solve this problem, it's just that this recommendation as in its current form, I think would impose a burden on the judicial system that they are not at present well equipped to handle, and leave us right back where we started. Again, as we said some months ago, I'm of the opinion that we needed an integrated electronic communication system that could communicate fairly smoothly. But the adoption of this amendment, I think, doesn't necessarily get us closer to where we want to be and could potentially cause more problems. Judge Clary, I'd certainly invite your input on that, but I wanted to flag that concern for the committee, and to the extent the department wants to weigh in on it, tell me why I'm not right. Love to hear that as well. It's been a thing today, so just sort of open the floor.
I'm going to let Ms. introduce.
Turn your mic on.
Is that better? Okay,
Whole
great. So with respect to this recommendation, it's our position that as a part of the executive branch of government, SCDC is not the proper party to be awarding jail time credit subsequent to the sentencing proceeding. Jail time credit impacts the actual length of an inmate's sentence, the amount of time they spend in custody, and that's something that we feel is part of the judicial function. And I would note that until March of 2003, there was an actual spot on the sentence sheet for the judge to write the actual amount of credit. And I don't have any information on why that was changed, but I just thought it was worth noting. But jail time, as I said, jail time credit impacts.
I think Mr. Cassie's question is, he's afraid that the judge will just write time served.
No, that's what the language is trying to change, is that the court shall determine the credits to which the prisoner is entitled. So what we want to see happen is the parties get together, solicitor and defense attorney, and of course the defendant, who knows where he's been in jail and can tell his attorney that, get
Not always.
together.
Not always. Unfortunately, not always that's
Well,
the case.
In a perfect world, the
Sure.
defendant would know where he's been in custody, and all that would be presented to the judge. The parties could get the jail time sheets prior to the plea or trial and present that to the judge, and the judge would write the actual amount on the sentence sheet, and then SCDC's job and function as part of the executive branch would just be to input that into our system, and that way nobody is surprised down the line. And I'll tell you that a lot of the problems have come up with the audits that have been done, especially the Hayes audit.
Right.
We've been going back and having to obtain more jail time forms, look back into pre-trial, not just pre-revocation hearing in a probation revocation, but pre-initial probationary sentence. We're having to look back, and sometimes under the Blakeney case, we have to look to several different counties and try and gather all this information. And sometimes we have pushback from the counties, or they don't want to. And I have some examples that I can send to the committee, pages of them, in fact, where we have either, let's see, we have problems with the reliability of the jail time forms. Sometimes we'll get several different forms that say different things, and they're all dated the same day.
Right. Ms. Bigelow, I don't mean to interrupt you. Well, I do.
Sure, absolutely.
I want to interrupt you here because my question is not whether or not that's the right answer, because I think on some level it is, right? You make the argument that this is an executive function, or this is a judicial function, not an executive function, but we've already created mechanisms by which we have the executive branch determining credits for inmates. So inmates' behavior, their participation in certain programs, we've vested within the executive branch the authority to make
Those are
determinations
inmates
that
in our custody.
once they're in your custody,
And
sure.
the jail time would not be in our custody.
Right, but to the extent that the judge is currently awarding credit for time served, what he's done or she has done is say, executive branch, do the calculation, which is problematic, as you point out, and a problem that we've spent a lot of time on here. I'm concerned simply that, and maybe the answer is we should just put it on the judicial branch and hopefully thereby incentivize them to participate in this process more fully so that we can be more accurate in it. So maybe we should just shift it onto the judicial branch. But at present, and this is just the concern that I want to raise to the committee, is that the judicial branch, near as I can tell, is not prepared to take on this task, because for whatever strengths and weaknesses may exist in the department, it is better off than the judicial branch right now at doing the actual calculation, where you have to go across a number of different jurisdictions to do the calculation. The judicial branch, I don't think, is prepared at all to do that. But again, maybe I've just talked myself into the circle here where we should just shift it on the judicial branch and make those, ladies and gentlemen, solve this problem.
You know, in federal court they do that, but I think what we're saying is they may have the best information at the time to do it. I hear what you're saying, and that's our recommendation. I mean, it'd move R&E process, and that's just kind of, I think if you get everybody in the courtroom at the same time, you know everything that's going on at that time, and it'd be less likely that there'd be a mistake made by SCDC. That's just kind of, y'all asked for recommendations, and we're looking for best practices, and you know, we've made several changes to our system, as y'all have seen, since we started this process, and this is a recommendation that I think if everybody's in the courtroom, you know, the defendant's more likely or not to say, hey, you know, I did 2 months or 4 months here, y'all forgot about that. So that's just our kind of 2 cents.
Before the chair recognizes my good friend and colleague, Mr. Clary, I don't dispute that at all, but I also have seen, just personally, anecdotally, in my own practice, inmates have varying levels of intimidation or nerves at sentencing, you know, and so someone who may very well know that, okay, when I was in Pickens County, I was there for 10 days before I was moved to, Anderson County. And they don't voice that at that moment because, unfortunately, one aspect of our criminal justice system is that, particularly with folks who are represented by public defenders, it is high volume and it is fast, and the amount of client attorney contact is unfortunately limited. So I'm with you. I think this would be a huge step forward. My concern is a practical one in that I don't know how the judicial system, if we shift this onto them, they're going to respond. And so I have some trepidation here. In the end, I may end up supporting it. I just didn't want this to not have been voiced.
I wish we had pre-sentence reports. I wish we spent time where there was and that's a giant resource. The federal government does it. It works great. I really do wish we had the ability to do pre-sentence reports so we would know all of this information when you're in court and it's boom, this is what you're going to do, this is what you need, blah, blah, blah. That's a lot of resources, but I wish we had that.
I don't want to ruin the surprise for those who may come back and watch us take up Triple P, but that might be something we have to talk about with them in the future. Anyway,
I guess
thank you, Mr. Chairman.
It's balancing, who do you think is better able to do this at this point?
Judge Clary?
We have spent an inordinate amount of time on this very issue because it's a really important issue. And I think that when we had the judicial department here, we got a lot of, we just got a lot of nothing. And I think that the circuit judges in this state have the unique ability and authority to require that this information be provided, as opposed to a lot of other people. It's not, when SCDC is calling the counties and, they get pushback, well, they're not going to push back a circuit judge. And what it's incumbent upon the General Assembly to do is to elect circuit judges that are not going to take no for an answer in these situations, and also that have the experience to know what's going on. A lot of times we'll elect circuit judges, maybe never been into criminal court. And so that's an issue. But I think that this is a step in the right direction. Is it going to solve the problems? Probably not, but at least it moves it another step, and it's going to, listen, I don't know how much has been going on lately anyway, so, and I'm sure that the numbers continue to go up with their dockets, but, this is, having done this, I always tried to put a number, and I'm going around the courtroom saying, all right, tell me what the time served is. And if the defendant says, well, I was here or I was there, I'd say, okay, well, let's just stop this until we can get the right number, because I've got everything done except filling that number in. And that way it can be done. Does it take some time? Yes, but that's what we elect them to do.
Time is important in this, and it's, as I said, when this came up, this is one of the most important things that we can do as a department. It's a core function to make sure people serve the appropriate amount of time.
But because we have seen time and time again at meeting after meeting where we've had people who their sentences were not correct. They'd served too much time. So that's the thing that I want to.
We put fail-safes in to make sure, but we have humans doing it, and we have humans doing it.
Any other questions? Is there a motion? So moved to accept. Representative Williams, call the roll, please, Kathy.
Representative Caskey. Representative Clary. Representative Dillard. Representative Jefferson. Representative Johnson is not present. Representative Williams. And Representative Talon.
Aye. Excuse me just one second. Representative Williams, I think you have a general question.
Thank you, Mr. Chairman. I just have a general question that deals with the vacancy. Just wanted to know what the agency is doing different from the beginning to address the vacancy issues that you guys have at SCDC, and just wanted to kind of share with me about what you guys are doing to try to increase the numbers for vacancies.
So I'll do a quick introduction, and I'll try to answer, and then Jessica will answer too. Jessica Lovelace is in charge of our HR function, and Joel Anderson is our, and I would assume you're talking specifically correctional officer vacancy.
Yes, sir.
And Joel Anderson, who's going to step up, is in charge of our facilities. New hires in 20 was 1,309. Total since COVID started mid-March is 316. A couple things that we're doing is a thing called forensics. So we're checking people on the front end. There's a lot of conversations about law enforcement and their capabilities to be in. It's a powerful job. I mean, as we've seen, it's a very powerful job. As Senator Scott spoke very eloquently on the Senate floor, one of the best speeches I think I've seen in a long, long time on the Senate floor, with passion, with personal experience, and with the ability to get things done. He had some examples of how law enforcement is so powerful and can be the difference in someone's life. So we are doing a test up front called forensics. It's a psychological test. It's a test when you bring contraband in, where you harm someone in your custody, things of that nature. And we've seen a 20% increase in our retention. So I think that'll be over our 1 year in June. So we're almost done, but we've seen a 20% increase, which is, before it was 1 in, 1 out. We're not seeing that anymore. I think with some of the things Mr. Anderson is doing, people are staying. One of the things I discussed that I look at is we're looking not only at total, you can say, and Mr. Caskey's interested in numbers, but you can say, hey, we lost, I don't know, I'm gonna throw a number out, 900 people last year. I don't think that's how many we lost, but anyways, where did we lose them? Why did we lose them? So with this prison, we lost this many. Why is that number so high? It used to be, because that's a level 3. Well, this prison doesn't have the same problem. So then we pare back the onion a little bit and say, okay, well, what shifts do we have? Well, it's this shift. Well, that shift's a problem because of X, Y, and Z. Well, this shift at this prison doesn't have that problem. So what's going on? Is it a leadership issue? Is it who's in charge? And one example comes to mind. We had someone that was working a shift where people, it was just turnover. People were leaving left and right. A lot of complaints. And I think y'all heard some of those complaints during this this testimony from some people that worked at SCDC. So we looked, and the old way used to be just get rid of them, don't worry about it. Now this is a training opportunity. We're working with Midlands Tech, we're working with other leadership people, and one of these people we salvaged, and that institution has 19 new hires. We've got Perry up in the upstate. How many new hires?
35.
35. So we're looking at trying to support our people and not just get rid of them. It's something that, I don't know, how many times do I ask about this? Every day. Literally every day, because that's how you get stuff done, is you got to ask about it every day. We also have hired a company to do that in Alabama. They were court ordered to do this, but I think it was 400 people or 400 people in addition that they hired, which would be just manna from heaven for us if we had that many people. 20% is great. And with our population going down so much, that's very important. And we know how important it is, but I'm going to let Ms. Lovelace talk about, and I'm going to let Mr. Anderson talk about his philosophy. But Ms. Lovelace will talk about what we're doing with this company, the name of the company, and the marketing. And we did an emergency procurement because we'd still be in procurement for this thing if it wasn't for our ability to do that. But we intend to look at what's happened. Unfortunately, if we didn't have COVID, we could say, okay, this company works. But because of COVID and the unemployment rate, it's kind of hard. We're looking at apples and oranges right now. But we have more people, so with me, that works. But Ms. Lovelace?
Jessica Lovelace, Assistant Deputy Director for Administration. So the company that we're working with, that actually worked with Alabama after their lawsuit is called Markstein Blue something. I'm sorry, it's Markstein, and what they do is they take a really targeted advertising approach. So they would see that someone was Googling maybe correctional officer or law enforcement. And if it was a female, they would target that, their advertising would be targeted towards females. Like helping people develop, helping people rehabilitate, things like that. And if it's a male looking, they're saying, are you interested in law enforcement? So they're doing a very targeted approach. Their recruiters are working with our recruiters, and people who we cannot reach out to, they're talking to them as well. So they're just helping us with our advertising and helping us with that targeted approach.
How many more recruiters do they have?
I'll have to confirm. I don't know off the top of my head.
More recruiters out there too.
Mhm.
Probably every single one of us may get an ad if we go on social media after this. That's just my tinfoil hat theory on how things actually
Right.
work. But it seems to be when you talk about something, all of a sudden an ad shows up in one of the social media things. So that's what these do. But how many more?
So far, we have hired 17 people, which is using them. It's up at the end of this month, but we anticipate that we would be able to hire up to at least 50, or up to about 50 by the time the emergency procurement's over. And they've reached out, I'm sorry.
Go ahead.
They've reached out to over 200 people that we haven't been able to reach out to.
In talking to Colonel Jeff Dunn, the director in Alabama, similarly situated state, they've had great success with it. That's why we wanted to do it. I'm going to let Mr. Anderson, if you allow him to kind of talk about his philosophy.
Before he comes, a question as it relates to Markstein, the company itself. Are these interstate hires, or are these a national blitz?
I can get that information for you, but the advertising is national.
Okay.
So y'all, for example, we've got several wardens from other states. I can think of one right now, but I think there may be some others that have come in. They could work somewhere else, and then they can come here. They can get their full retirement from that state and come here. And with the tax credit, y'all gave a tax break on law enforcement military retirement. You know, those are the type of things that we talk to people about when they come in. Like, look, you can move from the Northeast or Midwest, and you can come down here and you can get a tax benefit also.
Well, make sure they don't come with a bad rap, bad record, coming just to come down here just to work.
Yes, sir, we check. I mean, obviously we check.
We do, yes.
Okay.
And one thing they are doing as well is, and we'll be happy to send you all the link, is they've really upped our advertising. We have some really great marketing videos out there now that we wouldn't have had the ability, or the resources to do on our own.
And before it was TV, radio, billboards, it was like a scatter shot. Now we're still doing that, but we're trying to focus more of a razor, a rifle shot, where we're focusing in on the person that needs, that's interested in coming to work for us. And the pay's helping. I mean, let's be honest. Before, the pay was under $30,000 and no overtime. The pay is helping. I don't think we're not seeing the lockdowns and things of that nature.
But as you know, the best way of advertising is the word of mouth. You know that, right?
Yes, sir.
So therefore, it's imperative that SCDC increase the morale of your agency, so that people within the agency can go out and advertise and certainly bring folks back in. So just curious about the morale at some point.
I think Mr. Anderson can talk about that. He started last March.
Yes, sir.
So I think he can talk about his philosophy and the morale and things of that nature.
Well, Joel Anderson, Deputy Director of Operations. What we've done, Mr. Weaves, you and I have had personal conversations walking around touring the institutions. And what we've done, in essence, is we've taken these employees, 35 at Perry's a big number, 12 at Kershaw. We got 9 at Lieber, or 19 at Lieber, 13 up at Trenton. So we're hiring people, but you're right, everybody's job is to recruit. When I'm walking around and I see these guys out there and they're kind of floundering about what they're gonna do, I say, okay, come see me. You come see me, sit down with me, and I'll tell you I can find you jobs, not just in uniform. We need everything from plumbers to doctors. And so we do that, and what we've done is employed the wardens and make them more active in recruiting. That's why you saw the 35 come Perry, because the warden went out and did these recruiting blitzes in these areas. And now you got 35 new hires up there, hopefully they're gonna keep them. We can make or break anybody. You can come to work for me today and I can make you quit in 30 days. I promise you. No, I would, my goal would be to keep you. In 30 days, I would like you to say, man, I'm making this a career, right? So we can make or break anybody, and that's the philosophy we're trying to put out there. You need to work with your people. I just told Mr. Caskey, the director talked about it. We've moved part of our training academy out to the field. We've taken the first week of orientation and the first week of our basic training academy, put it in the field, and the wardens go in those classes. They see the people firsthand. They don't just see them on graduation day up here. So they go in, introduce themselves, and then those officers get that OJT as they're working on the institutions till they get a date, till they get it.
And why is that important? We have a lot of people with families, a lot of people that are
Yes.
single parents. So you can't leave your family for several weeks. You're less likely to come and apply, but if you can go to that institution, number one, it creates a bond with the institution leadership, but you can do your training there. There's a little bit of training we still have to do, but this is something I've been trying to do, and Mr. Anderson and his team have gotten it done, where that mother or dad that has to be there, maybe has to take care of an elderly parent or something, they may say, I can't go to Columbia for however many days,
Right.
but I can go to my local institution and come home at a certain time and pick my kids up, and so that's why that's important.
Yeah, and at that point, they're hired, but they're still in their community so they can go home. So, and it's gonna benefit us a lot because not only the orientation week and the first week, now the second week of training academy is gonna come to us because we're doing a lot of it virtually now, right? So we have trainers on computer screens, we tape record a lot of the classes, but we have trainers in every institution. So we have training lieutenants at every institution that are making sure this happens. We've told the wardens, we've tasked them with making sure that these people that come to you, talk to them, sit down and say, hey, look, I'm the warden. Most people will tell you sometimes you walk in and somebody's been there 4 months and they'll say, you the warden? I said, no, I'm not the warden, this is a warden. So we don't want to ever have that happen again, right? Because that's ridiculous. So what we've done is gone back to the basics of corrections. You talked about morale, the basics, locking doors, locking gates, making sure people are safe where they're supposed to be, and morale is coming up. And what you're seeing is fewer people calling out sick. Our core staff, and I'll tell you this, I'm not going to get on a bandwagon because I could talk about it all day, but our core staff is some of the best in the nation, and this COVID virus has proved that. They come to work every day. They work overtime every day because their coworker is sick. So they come in and they pick this thing apart. So I'm telling you right now, the morale is coming up. We're starting to see people come to work for us that want to be here, that want to make a career out of it, and we're seeing that every day, everywhere we go. The wardens are doing a better job of treating those people like they need to be treated, and we're targeting, I'll give, Mr. Sterling didn't bring it up, but I will. When we looked at the institutions and we looked at different shifts and we saw that this shift only had 13 people and this shift had 31, well, what's the problem? The problem is the supervision in that shift, right? So we've given the wardens the ability to swap that supervision, take them, put them on a different shift, and bring somebody in that shift that can build that morale back up on that shift. Our night shifts are the most important thing we have, because if something's going to kick off, it's typically going to try to do it right in the evening time. So we need those night shifts shored up, and most of them is where we're shorthanded, is night shift, because everybody wants to work days or work on C-card. So we get those night shifts built up, you're going to see there's going to be a whole lot of things coming our way.
And C-card is basically 9 to 5 on
Yes,
the
sir.
week.
Yes.
Night shift is,
Monday through Friday. they
some
work
people
right.
like that, and some people, they want to get a bunch of days off and work a bunch of days in a row like the medical community does.
Right. But I'm excited about where we're going. I think the wardens are. We've got some really good wardens in place now, good associate wardens in place. So, yes, sir, it's a 12-hour shift for the COs, yes, sir.
Not for the C-card.
Most of us work 14, 15, 16 hours. But, the officers work their 12 hours. They're only allowed to work so much overtime. We do that for their own safety because they can exhaust themselves. So, but most of them pitch in and go to work, and they rely on each other, and that's where it is. It's like a family.
Well, I just hope that, as you guys move forward in this review process, that morale is a part of your daily operation. Because, if the morale is low, if the officers don't feel like they're important, certainly they're gonna work like that too. It's just human nature.
That's right.
If you don't feel appreciated, you're not gonna give you 100%.
Well, it starts from the top, sir, right?
Yeah.
Because I believe in servant leadership, right? I'm here to serve you. I'm here to serve the director, of course, but everybody under me, I'm here to serve them all. I tell them, that's not my office, that's your office. You just come see me. The director just put me in that office. And so I tell the wardens the same thing, and our wardens have responded really well.
Yeah.
So I think we're headed in the right direction. I hope that one day we can look up and say, we don't need any help.
Yeah. Well, it's all interrelated. Just like I said, I talk about morale, but certainly that basically even affects the inmates. The morale of officers affects the inmates, and it's going on down. So certainly we looking forward to seeing you guys improving the quality of life for those inmates as well as those officers within SCDC.
Well, that's good. I think this panel has made us a better place. So,
Thank you.
Williams. At this time, we're going to take a short 5-minute recess so each of us may have an opportunity to review our notes and determine if there's anything further we'd like to discuss before finalizing the subcommittee study report of the agency, which will be sent to the full committee for consideration. So we'll be in recess for about 5 minutes.
thank you.
All right, we're now back from recess. Are there any final motions or matters for discussion related to the agency before we finalize the subcommittee study report? Okay. Seeing no other items for discussion at this time, I'm directing the staff to update the subcommittee study report with the motions adopted during our meeting today and provide a copy to all subcommittee members by Friday, July the 24th, 2020. If any member would like to provide a written statement for inclusion in the report, as permitted by Standard Practice 12.4, the deadline for providing those statements will be 5:00 p.m. on Friday, July the 31st, 2020. I will provide full notice to the full committee that the subcommittee study is available for consideration unless I receive a written request for another meeting from a subcommittee member prior to 5 p.m. on Friday, July the 31st. I can't get 23rd out of my head, 2020. I'd like to thank the agency and my colleagues for their cooperation during the portion of this oversight process. And I want to remind those with us today, watching online or at home, that the public can continue to submit input about the committee study of any agencies via the Oversight webpage or by contacting the committee directly. The website and contact information is shown on the screen. As an update on the agencies, the next agencies the subcommittee is going to study, the Department of Probation and Parole and Pardon Service and the Attorney General's Office. We're looking to see when we may begin those meetings. If there's anything else for the good, is there anything else for the good of the subcommittee? At this time, the subcommittee is adjourned. Thank you, everybody, very much.